At HMC Architects, we consider ourselves visionaries committed to the health and wellness of our communities. We dedicated our entire careers to healthcare design and planning, and we have an important responsibility to make sure that we're providing enhanced care for staff, families, and patients. I'm Chris Naughton. I'm the healthcare practice leader for HMC Architects.
At HMC, we invest in research because we believe it brings real transformation. I'm Adele Najati. I'm a healthcare planner and researcher with HMC Architects. To truly understand and improve healthcare experience for our patients with cancer, we recently have done an in-depth research with some of our own HMC colleagues who have either been a patient themselves or had a family member in treatment. Their stories have become our lessons, and their journeys will inform the way that we design healthcare facilities of tomorrow.
After my husband's surgery, he was taken to recuperate on the top floor of the hospital. When I would go to visit him, I was surprised to find out that he was in a room that had 3 beds. There was no privacy. Everybody's machines around us were beeping loudly. Another thing that really concerned me was that because the nurses were so busy, whenever my husband would push the help button, there was a very long time he had to wait to get a response. This made me feel like if I wasn't hovering over his bedside every moment, he might not get the care he needed. After my husband's surgery, we went to a post-op appointment in the hospital's cancer care facility. It was located, strangely enough, in the basement of the hospital. We looked around and went, man, this is where we're going to receive treatment from here on out? After we found out that my husband would need a second surgery, we decided it was definitely time to change hospitals. And when we did transfer, it was to a campus that was completely and entirely dedicated to cancer care. On the day of his surgery, we were even given free valet parking and sort of just the red carpet treatment as we walked in. After my husband's surgery, he was transferred up to his patient room, and I was very excited to see that he had a room all to himself, and it was a large room. He also had a dedicated nurse who only looked after him at all times. It was so peaceful and so different from the previous experience that my husband, it seemed like just having that better environment made him so he spent less time in the hospital and recovered more peacefully.
Traditionally in healthcare, there's been a huge disconnect between emotional support and clinical intervention. You know, what's interesting to see is that over time, there's been a lot more attention paid to the whole health of the patient. The best cancer care programs support a person's emotional, spiritual, and physical needs.
The staff-patient relationship is a key determinant for a successful outcome.
A cancer diagnosis can turn lives completely upside down. With information and communication, we can give these patients some sense of control. Our purpose is to create spaces that support a variety of patients. And lastly, we can't forget about the providers that see heartache and despair every day. They too need supportive spaces to regenerate and to provide them a sense of peace and calm.